Bismillahirrahmanirrahim. I'm starting with the special toxicology, and this is the first lecture. And in this lecture, I will repeat the classification of the poisons. The most important classification is according to the mode of action, and they are divided into corrosives, irritants, neurotics, cardiac poisons, asphyxiants, and miscellaneous, in which various drugs and other poisons are included. Then the corrosives may be either the strong acids or the strong alkalis. And the strong acids are either the mineral acids, the organic acids, or the vegetable acids. The strong alkalis, they are caustic or potash soda and ammonium hydroxide. Whereas the strong mineral acid, they are the sulfuric acid, nitric acid, and hydrochloric acid. In organic acids, there are oxalic acid, carbolic acid, acetic acid, and salicylic acid. In the vegetable acid, hydrocyanic acid. So these are the poisons, how they are classified according to their mode of actions. Now starting with the corrosives, and I'll be discussing the general aspects of the corrosives. Corrosive, the corrode means to wear off, to ulcerate, to corrode, and the chemicals they cause basically the destruction of the tissues due to their natural action, and that's why they are called corrosives. How they act is that they corrodes the mucous membrane of the gastrointestinal tract or the surface on which they come into contact, and they convert the hemoglobin into hematine, and coagulation of the cellular protein occurs. The proteins are coagulated, and there is extraction of water from the tissue. Tissues are corroded, blood is proteins are coagulated, hemoglobin is converted into hematine, and there is extraction of water from the tissues get dehydrated. The mineral acid will be discussing in detail the sulfuric acid, nitric acid, but now I'll be discussing the general aspects. They act locally on if they are ingested on the gastrointestinal tract or the respiratory tract. If there are fumes which are emitting, they act in the respiratory tract. And no systemic action is seen in the acids, but except they cause the shock, or the oxalic acid has got a remote action. Now their mode of action is that they extract water from the tissues, they coagulate the proteins, convert hemoglobin into hematine. Then regarding the management of the steps in case of mineral acid poison, we should try to get the history because we can counteract the signs and symptoms. We do the investigation, then differential diagnosis, and general treatment according to the sign symptom, then the late investigation, then specific treatment. Regarding history, usually it is accidental intake of poison due to keeping the acid bottles mixed with the juices having the juice label. Regarding the general signs, the patient becomes anxious, pupils are dilated, eyes are sunken, and there erosion of the mouth, lips, and the both. The rapid and feeble pulse. Skin is cold and slightly sticky. noisy respiration, that is dyspnea. In sulfuric acid, brown or black discoloration, whereas in nitric acid there is yellow staining. And a red line demarcation is seen from the healthy tissue and from the tissue which come in contact with the acids. Now regarding the symptom, immediately after swallowing, there is burning sensation of mouth, lips, or the entire gastrointestinal tract, respiratory tract due to inhalation of fumes. There will be difficulty in swallowing due to swelling of the throat. There will be nausea, vomiting, and the vomitus can contain shreds of the blood mixed with dark brown or black in color stains. There will be difficulty in breathing, constipation and diarrhea can be there. Now, what are the investigation we like to do in early and late? 5 cc of blood sample, blood complete picture to find out the anemia, liver function test, they appear normal. Renal function test, in oxalic acid poisoning, they are deranged. Blood sugar is normal. Serum electrolytes, sodium, potassium, and calcium, they are deranged. Urine routine examination, there is scanty urine, and the vomitus should be preserved for the forensic chemical laboratory. Now, regarding the differential diagnosis in acid poisoning and in alkali poisoning, both should be differentiated. What type of corrosive material it is? It is acid or it is alkali. And the burns which will be seen, the injury in the alkali will be severe, whereas in acid is less severe. Necrosis in alkalis there will be liquefaction, whereas in acids there is coagulation. And the burns in alkali they are deep, whereas in acids they are second degree burns. Edema in alkali it is marked, whereas in acid it is mild. Scar formation in alkalis there is soft, edematous and translucent, whereas in acids it is hard. Regarding the charring, it is not seen in alkalis but it is seen in acid. So the most important step in the management of poison patient is what to do and in which order it is to be done. Regarding what to do, it is a much more important step to think than to provide an agent to reduce absorption of the poison or to counteract its effects. The fact is that the patient must be treated first and then the poison. Once the victim is stabilized, only then try to identify the poison, its quantity involved, and how much time has passed. So the flow of chart in the management will be that after clinical evaluation of the patient and after saving the life of the patient, the next aim should be removal of the unabsorbed poisons, elimination of absorbed poisons from the body, and treatment of general conditions and symptoms. So the steps of management will be clinical evaluation, non-specific antidoting, dilution of poisons, emesis, adsorbents, cathartics, gastric lavage, forced diuresis, demulcents, dialysis which may be hemoperfusion, specific antidoting if you come to know the type of poison. Now regarding the treatment, stomach tube and emetics are contraindicated in corrosives. However, soft tube, Levine tube, they can be passed with care within 1 hour to prevent serious caustic injury. But after that, when there is corrosion, ulceration, then it will be difficult to pass. In acid poison, the alkaline carbonates and the bicarbonates, they are contraindicated. However, the weak alkalis like calcium and magnesium hydroxide, along with plenty of water, or neutralizing agents like milk and egg albumin, they can be given. In alkali poison, neutralize the poison by giving weak acid like acetic acid, citric acid, mixed with large quantity of water. Morphine can be given to relieve the pain, ice to relieve the thirst, and IV fluids to compensate the fluid loss. And steroids to treat the shock, and to prevent the esophageal strictures, keep the airway patent. Tracheostomy, if acute edema occurs of the glottis, then the tracheostomy should be done. Poisoning by ammonia vapor, give oxygen. Keep the patient nothing per oral. And nutrient substances are given by IV route for a week long or about a week. Then try liquid, soft food, and finally a regular diet. Antibiotics to prevent the infections. Now regarding the cause of death, immediately the reason can be shock, suffocation because of edema and spasm of the glottis, gastric perforation, and delayed when the quantity of poison is small, hypostatic pneumonia, esophageal stricture, emasculation, emaciation, and malnutrition can occur. Then second infection can be seen. Regarding the postmortem appearance, it depends upon quantity, the strength of the acid, and how much time the patient survive after the intake of the acid. Then corrosion of the mucous membrane of lips, mouth, throat, skin over the chin, angle, mouth, and hands. Necrotic area, brown, black, and leathery. More marked in cases of sulfuric acid poisoning. Tissues stained yellow in nitric acid, and in sulfuric acid they are dark black in color. Gastric perforation, especially in sulfuric acid, can irritation of respiratory tract, having the volatile fumes like nitric acid and hydrochloric acid. In medical aspects, in attempted suicide, not seen nowadays because there are a number of other materials which can be. And for homicide, rarely because of taste, immediate local action, physical change it produce in the food. Accidental severe injury or death. Sometimes it can be used as abortifacient, sulfuric acid and the hydrochloric acid. Now, vetolage. What is vetolage? Throwing of any corrosive on a person with malicious intent. But why it is called vetolage? Because commonly the sulfuric acid is thrown, and sulfuric acid is known as oil of vitriol. So after the name of oil of vitriol, the name vetolage comes. Now these fluids are usually thrown on the face for destroying the vision or cause facial disfigurement. And this results in grievous hurts. Thank you very much. We'll continue special toxicology in the next lecture.